The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us on this dimension of eliminating diabetes, session 4. The first 3 sessions we're dealing with, of course, eliminating diabetes along with elimination of hypertension or high blood pressure, obesity, and high cholesterol. So if you didn't see all of the first 3 sessions, you can always contact us, and we're happy to send you CDs or DVDs of them, and I think you're going to find this program really good today. So as a little review, what is diabetes? Almost everybody knows what that is. It means that the person's blood sugar is up above normal. And so we're going to take a look at a slide right away, and we're going to look at what we call glucose markers or blood scan. This is part of a blood scan, and when we do a blood scan, they're always called markers. And so these are traditional right across the board in all of the health industry. So on your far left, you see the term glucose or blood sugar. The clinical range for that marker is between 85 and 100. But then on your far right, you see the homeostatic range. So that is the optimum range. In other words, when it goes below 85, it's hypoglycemia or low blood sugar. When it goes above 110, it's called hyperglycemia or diabetes. Homeostatically, the optimum range should be between 85 and 100. And so we see here now the next one is sodium. The range is 138 through 146, homeostatically 140 through 144. Cholesterol should never be lower than 140 nor higher than 200. Clinically, homeostatically, it should be in the range of 150 to 180. The triglyceride should be between, does that say 10 and 195?
Yes.
And homeostatically between 80 and 115. LDL, that's the good fats, that's between 35 and 190 clinically, and homeostatically, the optimum range should be between 50 and 110. The high density lipoproteins, between 35 and 55 clinically, homeostatically between 55 and 120. And then the computer always gives us a total cholesterol HDL and a total LDL HDL. So now we're going to move on to our new material, and we're going to look at some ideal laboratory numbers. And those ideal laboratory numbers, when we find glucose that's too high, then we're going to do fasting blood glucose. Mm-hmm. And so fasting insulin should be between 0 and 115, fasting glucose between 65 and 85, fasting triglycerides between 80 and 115, fasting cholesterol, and we do all of our cholesterols on fasting. Matter of fact, we do all of our lab scans on fasting between 100 and 180, and the 2-hour prostrandial insulin should be lower than 50, and the 2-hour postprandial glucose should be below 140. So now Dr. Jensen is going to talk about these numbers. And the good question is, do you know your numbers? Do you know your numbers?
Do you know your numbers? And really what we want to do is take a moment here to tell you what the difference between clinical and homeostatic is. Clinically is usually those numbers that were taken within a hospital setting, how they're doing blood draws on each of the people that were in there. And they found out the clinical numbers, when people fell outside the clinical levels, they actually presented with clinical symptoms. And then what happened was they got an idea that they'd go outside of the hospitals, the people who, because in the hospitals, you usually find people who are sick, who are unhealthy. So then they wanted a population of people that they would look at that these people were healthy and see what those levels were. And those levels are called homeostatic. That means that the body is still in control of these numbers, and they found that the health would be a thinner a thinner range in between the clinical level. So that's why you saw those two separate numbers. One is that you could be horizontally sick, meaning you're walking around and you're just not feeling well. If you're outside of that, we call that horizontally sick. Inside the clinical range, we call that vertically sick, and then inside that, there's a thinner range in which you are indeed healthy. And so when we look at health is in the blood. Now, some of the other markers that we would look at for in knowing your numbers is to see if there's an elevated waist to hip ratio, which is greater than 0.9. You want to check to make sure that the waist is not larger than the hip. If that's the case, then we want to look at whether you have an increased BMI, which is, doctor, BMI stands for?
Basal metabolic index over 27.
Right, and so if it's over 27, you're looking at obesity is taking place. Serum triglycerides to HDL ratio above 5. What we find is when you're looking at your numbers, if your triglycerides are high, it normally shows that you're having a problem metabolizing your sugars. And so in which case we see the triglycerides go way high over the cholesterol. And so what we want to do is also take a look at altered insulin to glucose ratios then, because what happens is when the body's having a hard time dealing with glucose, it might have insulin insensitivity or insulin resistance where it's just not using the insulin, and therefore it's keeping the sugar levels high out in your blood. And when that happens, that sugar bonds to your red blood cells, and when it does that, it makes the outside sticky and it makes them brittle, kind of like brittle candy. And when that goes through the real thin capillaries, the real thin arteries of your body or vascular system, they try to twist to fit through there and they'll break up. And so that's what happens with an old cell. You can tell the age of a cell by how much sugar it has on the outside. And that's really what they're measuring with the HbA1c. That's hemoglobin A1c. And so that's what we're really looking at to see what's going on as a measure of insulin insensitivity. Then we want to look at a mineral analysis. Yes, glucose or insulin insensitivity or hyperglycemia can change what's going on with your minerals. So we want to check the vital minerals and toxicities that may be there. So we're looking at chromium and copper and magnesium, manganese, zinc, aluminum. Aluminum may have a toxic buildup in here, and it's implicated, actually, aluminum is implicated in diabetes. So the deficiencies of several of these minerals have been identified with patients with diabetes. So we're looking at correlations there between the minerals and insulin insensitivity, where they can have excess urinary losses of these minerals just because it's used in dealing with excessive sugar. Plasma levels, yes.
So if they're going to diagnose or treat diabetes, they need to see their blood markers as well as the mineral markers and a hair biopsy as well. Then.
Right.
To do one without the other would be like having one hand tied behind your back.
Right, and it all has to do, those minerals are basically cofactors inside the body that help the rest of the metabolism in the body deal with what they're dealing with. So they find like the mineral vanadium. Vanadium they actually found was almost like giving them insulin. It just potentiated it so well that it was like that. Same thing with chromium being a potentiator for insulin. So if they have a chromium deficiency, we're looking at things like hyperglycemia, glucose intolerance, elevated triglycerides and cholesterol. In humans, supplementation resulted in improved glucose tolerance, insulin sensitivity, and reduced total cholesterol by 5 to 12%, while raising the HDL by 8 to 36%. So that's just one mineral.
And that was based on having the marker of the blood and the hair biopsy, not just saying I'll go to the health food store and take something.
Right. It's not just saying, oh, let's take chromium. If you already have elevated levels of chromium, what sense does it take to have that? There's something else that's missing in there. So if you never measured, you don't know, and you can't then come up with a good treatment for that individual. So then...
What about after diagnostic testing?
After diagnostic testing, you want to eliminate refined carbohydrates, eliminate the sugars, basically, that are released into your bloodstream at much greater levels. Then you also want to replace those carbohydrates with low carbohydrate foods. They tend to fill you, but also they help regulate that blood sugar also. You want to consume proteins and fats based on an IgE and IgG4 food sensitivity testing. Many times people will start to eat foods that they feel are good for them, but one man's food is another man's toxin. And so if you're, such as some of these remedies that you might find from, say, home-cooked recipes that are supposed to help. Some people will start to use that and say, oh, I'm getting much better, where ideally when they look at their blood tests, they're actually getting worse, or they're eating something that they're sensitive to, driving these numbers further and further out. So one of the things that they might also do is to take food supplements based on blood scans, because that gives us a science-based nutraceutical supplementation regimen for which they should take. It's not just our suggestion, it's what your blood test says that you should be taking for you individually. Now, nutritional considerations. Nutritional considerations might be that you might need to take some EPA-DHA, which is actually essential fatty acids, which will help to reduce cardiovascular risks. If you've watched the other sessions or parts of this Eliminating Diabetes, you find that there's really a 15 to 20 year progression of insulin insensitivity that leads to diabetes. And diabetes is the end result. However, what we find is in that 15 to 20 years, a number of these markers, the triglycerides, the cholesterol, all those things are going up, causing many other deleterious conditions in the meantime, so that people will have cardiovascular problems or, say, autoimmune problems. Things like that that can occur due to a lack of being able to regulate their blood sugars. EPA-DHA helps with that, as well as the sensitivity of your cells acting at the cell membrane for that. CLA, conjugated linoleic acid, enhances insulin sensitivity. Lipoic acid is an antioxidant, has antioxidant properties, and may restore diabetic neuropathy in as little as 4 months via the study in Diabetes Care. So what we're looking at is lipoic acid, which is another fatty acid that we're on. When people have problems with diabetes, it really reacts with not only their blood vessels, but it reacts with their nerves. In fact, what they're finding, and I found this from talking with a medical neurologist, that it's actually what's happening is you hear about mini strokes affecting the brain. Well, here are mini strokes affecting the peripheral nerves also. And so what they find is the lipoic acid helps to counteract that, and that people indeed start to get back more sensitivity through that supplement. Vitamin C, helpful in reducing neuropathic effects of diabetes and diabetic retinopathy. So when we find vitamin C is usually found in its highest quantities, not only in the adrenal glands of the body, but also in the eyes. And so vitamin C is very good for nutrition for the eyes, and in this case they're finding that it helps counteract diabetic retinopathy, which we've showed you the results of that on a past program. Proanthocyanidins, reducing complications of diabetic retinopathy. These are chemicals that your eyes use in the nervous system. So then what do? Well, since diabetes increases inflammation, which we'll get into in some other programs, we want to be able to counteract that inflammation. It's as we find that diabetes increases not only waist girth, but that fat cells being actually the largest endocrine gland in the body. It gives off 25 different chemicals that can directly lead to higher inflammation, and what higher inflammation does is it reduces the sensitivity of those cells to insulin and good sugar metabolism. So in which case we need to lower that inflammatory response or calm the inflammatory response. And so what happens here is, as we take a look at this slide, we see that there's immune cells identify the antigens in the body. This is how inflammation activates immune cells. And then the immune cells produce cytokines. These are actually chemicals that attract more white blood cells to that area and also recruit inflammation. And so as we go through that with calming the inflammatory response, we see one up in the corner here with this arrow, this red arrow that's up in the corner here. This is showing the cytokines that they come in, and their response for signals is some messengers in here. And those messengers actually go to the immune cells, to the nucleus of those immune cells. And that sends out more chemicals to create more of these inflammatory type chemicals here that say, hey, let's raise inflammation. And so it's trying to calm this signal here. And in doing that, what we can do is see there's where that signal takes place. It affects that intercellular signal. An intercellular signal goes into the cell nucleus, which tells it to create more of these inflammatory chemicals, which then those chemicals then are released, and what we're finding here is it'll increase inflammation in the joints. That's why a lot of times these people feel like they're a bit arthritic because of the swelling. And so one of the things that we try to do is cut off that original signal to help reduce the signal that's taking place. This is not cutting off the housekeeping signals in the body. It's cutting off the response of the body to other signals that want to be pro-inflammatory. It's very important, the difference between housekeeping and cutting off that inflammatory response. Housekeeping, such as what we were talking about in some medications that were used to bring down inflammation, they were painkillers, had a problem with that they affected the COX enzymes. And the COX enzymes actually act as a housekeeper to keep the strength of our cells in our gastrointestinal area. So people were suffering from GI bleeding, and in some cases, it caused death. And so they had to stop those medications.
Sad.
And so in this case, what we're doing is we're not trying to stop the housekeeping signals, which are the COX signals there, the ones that are normally there, just the overproliferation of those by interfering with that inflammation signal to begin with.
And you can do it naturally.
And you can do it naturally.
Without any adverse reaction.
Right, right. And so that's what we're doing in this case, is stopping that signal from occurring.
Great.
So then we want to go to dietary management. And let me forward onto that slide here. Here we go, dietary management. Decreasing insulin stimulation requires dietary modification, which lowers the intake of foods that cause a rise in blood sugar and therefore insulin. So the options are to change the quantity of the carbohydrates and replace with fats, which cause no glucose response. Therefore, we look at a lot of these people it really helps them to go on these low carbohydrate diets. Or when we talk about low carbohydrate diets, remember that is not no carbohydrate diets. There's a difference there. It's changing those carbohydrates from the highly refined carbohydrates to the complex carbohydrates, those ones that don't release into the bloodstream super fast and cause this insulin rise and fall. So that's one of the things, is change your diet in that thing, and that's where it comes into to change the quality of the carbohydrates that we have. So then, we're looking at other things that might help, not only changing the diet, but some things that we can put within the diet. And in this case, this is a paper that talks about insulin for improved serum glucose levels, where they found where 60 people with type 2 diabetes were divided randomly into 6 groups. 30 received 1, 3, or 6 grams of cinnamon daily, and 30 received a placebo. Now the results were that after 40 days, all 3 levels of cinnamon reduced the mean fasting serum glucose by 18 to 29%. That's almost a third. The triglycerides were reduced by 23 to 30%. The LDL cholesterol was reduced by 7 to 27%. And total cholesterol levels were reduced by 12 to 26%. No significant changes were noted in the placebo groups, so that changes in the HDL cholesterol were also not significant. So, in other words, what they're finding is it preserved the levels of the good cholesterol, but it lowered the bad cholesterol. And when you lower the bad cholesterol, it means that there's less of a risk of cardiovascular problems that result from insulin insensitivity.
So if you're a diabetic, then you would want glazed cinnamon rolls to lower your blood sugar, right?
Yeah. Glazed cinnamon rolls. No, but you want to have a lot of apple pectin in there or whatever. They've got to be, what do they call it? Oatmeal cinnamon rolls. So that's a complex carbohydrate.
That's a complex carbohydrate.
Or in some cases, what some people did, where they just took a teaspoon of cinnamon a day, which is it's a hot kind of food.
How about other nutritional support? Are there any other things people can do naturally if they want to prevent diabetes, obesity, or hypertension? Or
certainly, there's other things that we can use. Nutritional support for earlier on the journey. You see, the earlier you do this, the more, if you're trying to steer a large ship, the earlier you start to steer that large ship, the quicker you're going to make that turn. And so one of the things that we find is that green tea increases glucose metabolism in adipocytes. Adipocytes is another name or a technical name for fat cells. So it's increasing the glucose metabolism in those cells. Cinnamon stimulates glucose uptake and glycogen synthesis to a similar level as insulin.
And glycogen is the form of glucose that's stored in muscles, right?
That's formed in muscles. You don't find it in meat, because what they find is the glycogen stores are used immediately. After death, it's just not storing in there. So it's just a different form of sugar, but it's used immediately when you're doing those short duration, quick bursts of energy. That's what glycogen has. Alpha lipoic acid. One of the interesting things, though, going back to that glycogen, is what they find is the sugar that's left out in the blood vessels that have the adverse reaction. If you take that blood sugar and move it out into the cells, then that adverse reaction isn't there. So that's the whole thing with moving that around. Alpha lipoic acid stimulates glucose transport more effectively than certain diabetic medications. So that's an interesting thing for you to try, and that was in Diabetes magazine in 2001. Specialized vitamin and minerals to promote healthy blood sugar levels, and we covered a fair amount of those in the other sessions of these shows, so you might want to look those up.
And we have the references. They can't see them on the screen, but they come from Modern Medicine, the Journal of Academy of Nutrition,
right.
Diabetes, and of course we have the Medicine Research Center, Functional Medicine Research Center, which I think it's an interesting trial of 37 insulin-resistant patients and what happened. Good research. This isn't just some goofball, witchcraft nutrition that's so much practiced today.
Right, and if you look at all those resources, those are all after the year 2000. They're 2001 and later.
Pretty current.
So it's pretty current research. And so we look at the clinical trial with 37 insulin-resistant patients. These are people who are having trouble with blood sugar. And so one of the things that you can do is use medical foods. These are foods that contain the necessary dietary constituents that help control insulin resistance, such as having fiber, as having the types of minerals that you might want and the vitamins that you want. So it's used for those kinds of people that need more of a regimented treatment. But what we find is the medical foods showed improvement in 3 critical insulin-resistant markers. One of them is, we find, was triglycerides. And the top one that you see there, that top graph on the right-hand side, is triglycerides. The light blue one is that triglycerides were at 323.8, which is really high. And what they found is afterwards, after 8 weeks on a medical foods program, it lowered it by 14% to 277. The other one was fasting insulin. That was reduced by 28%, from a 22.7 to a 16.3. Average decrease in 2-hour postprandial insulin was reduced from 111, and remember the homeostatic value of that was in the hundreds, down to at about 100, down to from a 36% reduction to 71.5. So these are very significant things that medical foods can help with. Then if we look at also medical food use, they find, and if you can read that on your screen, that there's an 85% reduction in postprandial insulin that took place after 8 weeks, and 49% reduction in medical symptom questionnaire scores for this. And that was after 16 weeks, it lowered, and after 18 weeks, that's where the two other measurements were taken. So then, Dr. Lala, attaining normal weight with aerobic exercise, how about that?
Well, that's interesting in that exercise helps maintain our blood glucose levels. So weight loss and exercise can improve insulin sensitivity and prevent disease complications. Most studies show that intense lifestyle changes can have profound effects on the occurrence and diseases such as diabetes and heart disease. Studies found walking 150 minutes per week was sufficient to reduce 7% of relative body weight. This alone was twice as effective as any drug control. So exercise is very, very important. Now the effects of exercise training on glucose. Here you are in the slide. You see this insulin sensitivity increased 10%. Glucose tolerance increased 3%. Glucose disposal increased 11%. Insulin response increased 7%. Fasting glucose decreased 7%. These benefits disappear in 72 hours from the last bout of exercise. So, if you will simply get involved in a good aerobic exercise program with some consistency every week, you are going to do a couple of major things. You're going to prevent heart disease, obesity, and diabetes, 3 of the major killers of disease in our society today. These things can be helped a great deal by you simply doing some exercises, reducing your intake of refined sugars or refined carbohydrates, getting a blood test a couple times a year to check out your individual biochemical nature, what your body needs. You aren't like a Chevrolet car that takes all the same gasoline. You need to biotype your own individuality, and by doing that, it's going to tell you what your body needs, what it doesn't need, and you're going to do a great deal to keep yourself out of getting sick from diabetes, obesity, or heart disease. You really will. So you can help yourself. You really can. We ask you to take a look at your health and take charge of it, and you will be blessed if you do. You really, really will.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.